Hello everyone. Thank you for joining us today for our webinar on comparing the Ministry of Health RA Summary to the PracticeCare Executive RA Dashboard. Today, we will be comparing how our Executive RA Dashboard from our PracticeCare program stacks up to the RA Summary that you received from the Ministry of Health. Let me start by introducing myself. I'm Maral Sanassian, the Director of Client Success at DoctorCare. DoctorCare is the largest provider of billing and practice support for over 2,500 physicians across Canada. On average, we have helped doctors recover $25,000 to $30,000 of revenue per year. Our solutions and services are designed to help doctors ensure that they are maximizing their revenue, improving patient care, and growing their practice. The purpose of today's program is to provide you with a glimpse of how you can obtain the same RA summary data you receive from the ministry in a format that takes a lot less time to access, read, get actionable insights from, and lastly, be applied to your practice right away. This is critical financial information that will ultimately help you enhance your practice's efficiency, revenue, and patient care. Our PracticeCare program provides a snapshot of the RA summary that is easier to read and digest. We generate reports that help family physicians improve on billing optimization, roster management, bonus optimization, preventive care support, and automated billing submissions. PracticeCare goes beyond just handing you a report on a monthly basis. Doctors are now part of an interactive, intuitive, and responsive program where DoctorCare is now helping you manage all aspects of your practice. This is the Ministry RA that you receive and review today every month. Your RA summary can be found in your RA after the seemingly endless list of claims. This is where the very valuable information can be found. So what is the problem with the RA and the RA summary? The RA is well over 50 pages long and is not easy to quickly scan and review. You do need to scroll through pages and pages of plain text back and forth to find very critical data points. Most of the data only contains your billings from previous months that look like a bunch of code and is hard to read. Most importantly, the RA does not provide actionable insights, which is why most doctors end up never reading it. In the past, we have tried various methods to help make the RA summary easier for doctors to understand and digest. For example, we've held and recorded webinars going through each section of the RA summary in detail for both FOs and FIGs. If you would like to watch our webinar on how to more easily read your RA summary, you can find the link in the description box below. We also tried to provide support to our doctors through one-on-one sessions, helping them interpret their own RA summary. But at DoctorCare, we still found that the RA summary wasn't being used as effectively by doctors as it could be. And this is because it is such a difficult document to decipher, navigate, and ultimately time-consuming to sift through. However, in our PracticeCare report, we do have specific report modules that dive further into the 9 key areas of your practice to help you more comprehensively address them in your faux practice and your faux billing. These reports contain more analytics, actual insights, and recommendations from DoctorCare. Now let's discuss the first part of the PracticeCare program report module, the Executive RA Dashboard. The Executive RA Dashboard is a module in our PracticeCare program report. 2 pages of critical financial information for your practice. Why did we invest resources in this? The Executive RA Dashboard was created to help doctors clearly understand the Ministry RA that they receive every month and how to understand their monthly income and what it is broken down into. We like to think of it as a simplified guide for the remittance advice. On the screen, you are seeing the section of the PracticeCare Reports module that contains the Executive RA Dashboard. It's just 2 pages and it contains key practice information from many different parts of your RA summary. And the information is presented in dollars, figures, tables, not just in plain text. Let's dive right in and step through how the dashboard contrasts with the Ministry RA. We'll start with contrasting total income for the month. On the left is where total income can be found in your Ministry RA. It's the first line in the RA shown in the red box. On the right is where we have it in our PracticeCare report within the Executive RA Dashboard module. Here's a high-level overview of the dashboard. Below the total income, we report on key revenue information for your practice by critical sections such as capitation, roster management, out-of-basket billing, other fee-for-service, access bonus, special premiums, preventive care bonuses, and other payments and adjustments. We report these sections not only for the previous month, like in the Ministry RA, but for the current month, the current fiscal, and previous fiscal years, so that you can see any trends in your practice and in your income. Then on the following table, on the next page of our practice care report, you get an additional revenue breakdown over your previous 5 months. This includes how much you made in each month and a breakdown of income streams for each month. Let's talk next about capitation and rostering. Every FO physician needs to be on top of their roster. Capitation for a FO doctor is a significant contributor to their total income. We notice that rosters do tend to fluctuate. Reasons for this could be that patients come off the roster from the ministry's end, or you yourself remove them. It is important to review and monitor the trend in your roster and capitation payments to make sure that your capitation doesn't decline, decreasing your total income. What we see often at DoctorCare is that patients fall off a physician's roster without you even realizing it. That's why it is important to keep monitoring your roster. As you can see on your Ministry RA, you'll need to dig up these critical pieces of information. You'll find both data points in the RA Summary section. This is why in our Practice Care Program Report, we have capitation and roster management sections within the Executive RA dashboard to ensure that you can easily view these critical data points near the top of the dashboard. With this view, you can understand if there have been any fluctuations over these time periods with your capitation, and you can get a clearer idea of your roster. We also provide a revenue breakdown for this critical information monthly for the previous 5 months. Remember, your Ministry RA will only provide you data for the previous month. Our Practice Care Program Report also has a separate and detailed module on roster management to ensure that you have all the actionable insights required to make sure your roster is up to date and managed appropriately. Next, let's talk a little bit about out-of-basket billings. We all know this is an important part of being in a FO, as it is a revenue opportunity on top of your capitation, where you receive full value for the complex services you provide. On the left, you can see where you can find the out-of-basket section in the Ministry RA. In our Executive RA dashboard, shown on the right, we report where you can track and increase your out-of-basket revenue. We don't just provide the data for the month. You can see the dashboard also reports on the previous fiscal and current fiscal figures for easy reference. Again, we also provide a revenue breakdown for this critical information monthly and for the previous 5 months. This is why our Practice Care Program Report has a separate and more detailed module on the out-of-basket analysis, so that you can get all the actionable insights you require to help increase your out-of-basket revenue. Let's move on to the other fee-for-service, which is mostly in-basket codes you bill on non-rostered patients. On the left, you have your Ministry RA Summary. On the right, in our Executive RA dashboard, you can track your other fee-for-service to make sure you are hovering below the fee-for-service hard cap that you are allotted. Once again, we also provide a revenue breakdown for this critical information monthly and for the previous 5 months. We have a separate module in our Practice Care Program Report to help you address your high-needs patients in more detail. This module monitors your fee-for-service potential on frequently seen enrolled patients to provide you with actionable insights and optimize your fee-for-service revenue stream. Let's move on to other income streams, which include WSIB and network colleagues. On the left, you can see how this section appears in the Ministry RA. It's near the end and buried deep in the RA. Contrast this with our Executive RA dashboard on the right, where the same information is very easy to access and read, while providing more than just the previous month's figures. We provide the current and previous fiscal year data, as well as report on the previous 5 months by monthly figures. With regards to the access bonus, on the left is where you'll find it in your RA summary. In our Executive RA dashboard, you can see the same information about your access bonus. However, you can also see your progress over a broader period. With our dashboard, you can also compare this to your overall financial position. We also have a separate and more detailed module in our Practice Care report that reports extensively on your outside use so that you can really maximize your access bonus. For special premiums, on the left is how it appears in your Ministry RA Summary. But in your Executive RA dashboard on the right, you can see the trend of how much revenue you are generating and which month you receive the bonus in. Again, we have a separate and more detailed module in our Practice Care report that reports extensively on special premiums and bonuses in your practice. For preventive care, instead of trying to decipher this in your RA summary, our Executive RA dashboard shows you how you are maximizing it. And we have another module in our Practice Care report that provides extensive details on preventive care, as shown here on your screen. With regards to the other payments and adjustments, you'll find it here in your RA summary. On our Executive RA dashboard, you can see the other payments all in one line. Most of the other payments are from ministry clawbacks, and you can easily see the deductions you are losing every month because of it. On the following table on the next page of the dashboard, you get an additional deduction breakdown for a longer period, your previous 5 months. In summary, getting critical information and financials from a ministry RA means flipping through and diving deep into multiple pages of a report that could be more than 50 pages long. Contrast this to our Executive RA dashboard. It's only 2 simple pages, conveniently laid out in table format for easy reading, and it contains more than just the previous month's data. We even go back to the previous 5 months and previous fiscal periods to give you more insight into your practice's health. I do hope this webinar has been helpful in explaining the differences between your Ministry RA Summary and our Executive RA Dashboard in DoctorCare's Practice Care Program reports. That is the end of our webinar. On behalf of DoctorCare, thank you for joining us today. If you have any questions or have any feedback on this webinar, please feel welcome to contact me anytime. My contact information is listed on this slide. Have a great day.